Thank you for tuning in to watch our Invest Greater Fort Lauderdale 8th Edition Leadership Summit. You're about to watch In Good Health, how bold collaboration is transforming healthcare delivery across Broward County and South Florida. And if you enjoyed this panel, subscribe for more. We're bringing you leadership conversations from CEOs from across the country, one city at a time. Well, Shane, you are not only the president and CEO of Broward Health, but you're also the interim CEO of Memorial Healthcare System. So before I get to the kind of questions about the industry and all the rest, how do you survive each day overseeing these huge organizations? Do you have one of your doctors check in on your stress level?
That's a great question. I don't have a lot of stress, even though it's a stressful job. I have a daughter who's 15, so that keeps me pretty grounded. So that's more stress, right? 15 is a tough time if you have kids. Oh man, we've got A&F right here in the front. I love it. They look great. They're really great. And you know what? You did well by talking about the birth of A&F really started in healthcare. So we'll get to touch on that a little bit later. But on what I do, I'm up early. I read a lot. We bounce back and forth between all the hospitals that we have out there. We have 12 with hundreds of clinics, so 30,000 employees, and we could talk more on that later. But staying grounded is keeping an eye on my daughter. I like when I get to drop her off at school. She has the dog, which she said was going to be hers, but it turns out Mom and I do most of the walk and clean area. Jay knows that.
Surprise. Yeah. So she's smart.
She's very smart.
She knows how to delegate.
She started that at an early age.
There you go. Well, awesome. Well, Broward Health and Memorial together serve nearly 2 million residents and employ approximately 30,000 people. Yet both organizations continue to invest heavily in new facilities, technology, and community-based care. What's driving that growth? And why does Broward County still need additional healthcare infrastructure?
That's a great one. Well, you heard Jason earlier. I don't know if he's still here, but if you listen to Moss, you listen to A&F, like Nelson, they'll tell you that the area is growing. There's more chronic illness, older population, and the influx since COVID has really more people are here. And a lot of the folks from the Northeast had their own physicians, use their own physicians, would fly home. We're finding that they're now staying here for that health care. I also mentioned that the certificate of need, I don't know how many of you know about that, but the certificate of need was done away with in 2019, which allowed a lot of the others that are out there, I won't call them competition, but the other healthcare systems that are out there decided that Broward would be a great place for them to come to launch, to start with freestanding emergency departments, more primary care. So I think you're seeing a lot more folks that need healthcare, but you're also seeing more competition, and there was definitely a demand, there was a need for it.
How much of that demand was seeking healthcare in neighboring counties versus flying to maybe where they had traditionally moved from?
So it's funny. So Palm Beach is traditional. They always say if you're sick, where do people from Palm Beach go? They go to their jet. Then they fly to the Northeast. We always think it's you, but here in Broward County, we love to think that Memorial and Broward Health are your healthcare providers of choice. I don't know if people know, but we were created by the Florida legislature. Broward Health is about 90 years old. Memorial's a little over 70 years old. And you did a great job talking about it. People don't realize it, and this is about economics. Well, people don't really think about Memorial or Broward Health until you need us. I like to tell people we're invisible until you're sick, you need a physician or something's happening. But we're a massive economic engine. You mentioned the numbers, but between the two systems, there are almost 30,000 employees. This year alone, we'll do a little over $6 billion in revenue, a little over 50%. Yeah, so you're talking about needing workforce and everything else. That is critically important here. And I think you're only going to see more growth. You mentioned earlier, so I think this will be exciting for the business folks in here. So healthcare is growing. We're getting bigger. The board of commissioners for both are two separate independent healthcare systems. They had to vote on it, but we've pledged and already put in motion over $1.5 billion that's going to be spent over the next 2 years. What's really neat is I see A&F here. They're building one of our freestanding emergency departments, which is exciting, along with other buildings. But what we have going on right now is there'll be a new bed tower at Memorial Regional. That's an $800 million project, 150 beds, 22 new operating rooms and more. Then we're going to have 6 freestanding emergency rooms. We just opened one last week in Lighthouse Point. One of the gentlemen mentioned the 2 medical office buildings. That's going to be incredible. One at Broward General, the main campus, which will be 8 stories, 200,000 square feet with 700 car parking garage, and then also at the north. So a lot going on.
And you mentioned $6 billion in revenue this year. What does that compare in the past couple of years?
Oh, probably several hundred million more. So really since COVID, we've seen since about 2015, there's been a real solid growth. And in COVID, there was a slowdown, believe it or not, for that 2, 3 years, even though people needed healthcare, people were afraid to come in. They put off on elective surgeries, but now they're back. But I would say all healthcare, and it's not just us, it's every healthcare system in Florida has seen this type of growth.
And you're mentioning all the areas that you're building, and you mentioned Lighthouse Point. How are you identifying the geographical areas in where you need to expand to, and how are you identifying which services you're bringing there first?
Right. So we use demand studies. The most important thing right now, people are looking for specialists and subspecialists. They're looking for more access. So we're trying to provide that. So we do work with a lot of developers who help us identify properties that are out there. I saw they had Mayor Levy here earlier. I thought there he is, Mayor of Hollywood. So the flagship for Memorial Regional is right there. It's the home of Joe DiMaggio. It's Memorial Regional. And also the mayor and city commissioner encouraged us to continue to do more growth there. We're building a new freestanding ER there on 441 and Hollywood Boulevard. Thank you, Mayor.
So, at times when healthcare organizations often compete for resources, talent, and patients, Broward Health and Memorial chose to collaborate. What convinced you that working together would better serve the community, and what's next for Better Together?
Yeah, I love that you asked that. The Better Together is a neat initiative. It's something that we've wanted to do for a long time. Jason, thank you for the shout out earlier. We were bragging about all that you guys are doing at Moss, which is incredibly impressive. It's nice to have A&F and Moss in the room. Later, there'll be a little arm wrestling, which is going to be fun. But these guys really are doing a great job, and we rely on them. Something that you brought up was the P3s, public-private partnerships. And so for those two medical office buildings, that's the first time that we're embarking on a journey like that, and it's really a great way or a model to move forward. So on yours, on the Better Together, what we found were there were unfortunately still in Broward County, a county of over 2 million, gaps and deficiencies in healthcare, but really in primary care and maternity care and a lot of the other areas. So after extensive mapping and data analysis, we said, where are the areas that need this? And so we started to go to those areas first. And the Better Together really came together to say, what could we do to prove to the community that these two healthcare systems, because some of you may or may not know, but we're safety net hospitals. And what that means is regardless of one's ability to pay, we take care of you. So we take care of the wealthiest, we take care of the poorest, and they get that same high quality care. Everyone is treated the same. And the reason for that growth and expansion is some of those pocket areas that aren't seeing the growth. We decided to flip healthcare a little on its head. We now have these mobile RVs and new primary care centers in these communities. That way they don't have to come to the hospital. They don't have to use the ER as their front door. And I think really the neat thing about the mobile RVs, and we do that in the city of Hollywood and like you name it.
Where can we see them?
I'll make sure you see. You'll love them. So they go to most of the cities. We just signed a commitment with the city of Pompano, 2 years. And what we have, these big mobile RVs will come out. They'll do health and wellness screenings. They'll do oncology. You name it, we'll do it. We usually kind of work with the city and the faith-based. Yeah, oncology. A lot of people stayed away. If you don't know this, hey, Jennifer Anderson from. I love when I get to see a big sponsor like that. She is very good with we raise and do well, but we don't. We need partners like Jennifer Anderson and others to help us bring in additional dollars to do these great things. But we are filling the gaps and deficiencies. We're going out into the community more, and the Better Together initiative is really to show that what can two large healthcare systems here in Broward County do for the community.
When I think of the Better Together initiative, it feels very unique. Are there other examples of this in the United States that you're drawing experience from to help craft this?
No, I'll tell you something. So a lot of people remember Frank Saka. That was my old boss. He was the CEO for the Memorial Healthcare System for 28 years. He never really understood why there were two healthcare systems, two taxing districts. And his thought would be you could create more efficiencies, be more effective. You could do better things for the community, reduce some of the redundancies, but also grow the access, grow bigger, do more for the community. He was really driven in the fact that our job is to take care of everybody. And so the Better Together initiative is really to try to prove we haven't seen it anywhere else in Florida. And I'll tell you why. I don't know if any of our competitors are here. We do it and it cost us money. So Broward Health last year alone did 553 million in charity care. So there's still a lot of areas that just need a lot of service that don't have insurance.
The Broward Health Point Maternity Care Center was expected to serve approximately 200 patients in its first year, but ultimately cared for 2,000. What does that level of demand tell you about the healthcare needs within our community, and how does it shape your approach to expanding access to care?
I'm glad you're asking. That's a great one. That one's near and dear to me. It is something that we've talked about, we've wanted to do, but no one ever pushed it, no one supported it. And the reason is it's expensive. And people said there really isn't a demand. The truth is there is a demand. and there was no access. So we were told if we did this, it's going to be costly. How can you do it? And the reason I mentioned Jennifer Anderson is we did go to our community partners out there. So Broward Health, Community Care Plan, South Florida. We asked them, is there a way that you could help us? Is there a way you'd be willing to come to the table? And they said, well, why do you think there's a demand here? So in Lauderdale Lakes, one of the cities here in Broward County, they thought maybe 200 women weren't getting the services they need. And that means they don't have a primary care physician, an OB/GYN, they're not getting prenatal care. So we said, well, let's at least try it. Let's build it in their community. Let's build it in Lauderdale Lakes. Let's work with the city. Let's work with others and see who would be able to do that. And so they said, you know what? They said, you'll be lucky if 200 women come through here. And you know what? Over 2,000. And so it is a home run. It has made sure that these mothers, expectant mothers, have an opportunity to not only get great prenatal care, but to make sure that these children stay out of the NICU.
Are there other areas of care that you anticipate to have a similar response?
We are. So we're looking at the continuance of primary care and then also cardiovascular care.
Yes. Broward Health has made significant investments in Epic, AI, and other advanced technologies to enhance patient care and operational efficiency. What are you seeing technology make the biggest difference today? And where do you see the greatest opportunities for the future?
Well, Epic is a huge system. I don't know if anyone knows what Epic is. A lot of the healthcare folks do. It's integrated medical records, and what it allows is if you're in a car accident, and it wouldn't matter if you're at Cleveland Clinic, Holy Cross, Memorial, Broward Health, all of your medical records are now there in my chart. The physician, when you come through the ED and present, can immediately look up and know. That way, in the past, they would wait, they would make phone calls, and it wasn't even emailed. It was actually fax. Someone would pick up the fax, and if they're doing things, they wanted to know if you had a prior surgery, were there medications that you're on, are there allergies or allergic reactions. So the system looks at it all, and if a physician's about to give a medication that would be contradictory, it will alert them. So what we implemented was Epic. It was an expensive, very expensive. We used a Cerner for decades, migrated over to Epic because they're one of the largest in the country, and they allow us to look at everyone's medical records. So it was a big investment. It took over a year to implement and to make happen, and then it took hundreds of what we call at the elbow service folks from Epics to be with the physicians and the nurses and other clinicians to actually ramp up and learn how to use this. And on the AI front, it's amazing. AI never sleeps. It doesn't need any vacation time. It's not asking for a raise. But where we see it useful for us is think about radiology. So in the old days, the physician would say, hey, we want to do a CT, an MRI scan or something like that. They might only say we're looking at the heart. Well, when you do some of the scans, it's also picking up heart, lungs, and everything else. When it runs the AI, it'll actually identify other abnormalities or other issues and spit it out. It doesn't say to the doctor, hey, you missed this or you weren't thinking about it. It's super polite. It says, hey, you might want to look at some of these other abnormalities or a couple of spots, and it really helps like with better early detection. So that's kind of the use we're having with it. We're not the tip of the spear Memorial Broward for AI, but we are involved and we're moving with it.
What other examples of AI have you implemented? Certainly, I think it's in everyone's life nowadays, whether it's professional or personally. Some of it's about speeding up processes, and at times it is also about eliminating positions. So what does that all look like for Broward Health and Memorial?
So for us on the medical side, it hasn't really eliminated any positions or even been contemplated. What's really trying to do, and you mentioned it, is scheduling. How do we make the ease of scheduling better? Patients always have a hard time. The AI is doing it and scanning. The other thing it's doing is it's managing the physician's calendars. It's helping us move patients in and out. So if you're there in the operating room, I'm in the emergency department, how are we moving you quickly if we need to admit the patient? How do we get you then out? Sometimes the doctor signs your discharge paper in the morning and you're not discharged till 6 at night. We hate that. And so what this is helping us do is really better manage that so we understand what's going on that aspect. And then another thing is the AI has these new listening devices, which are incredibly intelligent. You and I could have this conversation. The AI only puts in the medical. So I said, where do you hurt? Have you had any pain? What are you taking? But if I said, tell me about your family, what about your victim? It doesn't do it. It's really incredible. So like I said, we're moving it. Hey, Ina, we're tiptoeing into it. And really, I think we're taking advantage of AI and what it's going to mean for medicine.
And what about on the cybersecurity level? I mean, everyone is at any level is fearful of the cyber hacks, protecting one's data. I can't think of anything more important than someone's own health. How is your approach currently considering new tools like AI to help combat cybersecurity? or
So that's a
it's
big
true.
issue. And that issue really stems from our board of commissioners, right? HIPAA is a big deal. You're not allowed to ever give up any patient information. But what we have on a patient is unbelievable information, not just on how healthy you are, what the procedure, your doctors when you were there, but if you had a psych evaluation or any of those other things, those are confidential records only for the patient. So we have a large IT team. We have a CIO and a chief security officer for that, and they're constantly monitoring and working not only on that, but what are the things that other healthcare organizations are doing? Believe it or not, the federal government has been very helpful. They send out alerts. They'll let you know that things are going on. The FBI will do the same thing if they hear it at another hospital. So I think we're being extremely proactive, but from what I'm told, we should be scared all the time. There are a tremendous number of very sophisticated people who understand that way more than we do, and they're constantly hacking or trying to get into these systems. I'll give you an example. One time when we had it, we did have a breach, had to report it, and it was done it wasn't reckless. It was just an accident. The physician came in with his own laptop, decided he'd plug in, and that allowed someone to come in through the back door. Luckily, it was caught, but that's not what we like. So we've really locked down on all of that.
Broward Health has invested significantly in building its own healthcare workforce pipeline, from residency programs to community college partnerships. How are those investments paying off? And what would you tell business leaders in this room about workforce development, about why workforce development is also an economic development strategy?
It's huge. It's very huge for us. So as an organization that has 30,000 employees, we still have a deficiency at each hospital of about 1,800. We are desperate for people. We're trying to create these talent pipelines. I know she was here earlier, but Carol Hilton, who is if you don't know Career Source Florida and Career Source Broward, she is a mover and shaker, a machine. She makes it happen every day, but she partners all these organizations together and says, what do we do? And then she has all the different areas. For healthcare, we've gotten several grants from Carol and also from the state of Florida. And how do we create and work on that talent pipeline? So we work with the state colleges, we work with the universities. She helps us go out there and find these others. We're trying to tiptoe into the high schools, right? Those that might be a sophomore, junior, or senior. If you have any thoughts or ideas in healthcare, we can help get you certified. You can do your clinical rotations while spending time with us at one of the hospitals. And when you're done, you could start off as a medical assistant. There's a tremendous amount of jobs that are out there. And it's big for the economy. If we're training people, we want that workforce to stay here. We want them to have a high wage. You heard A&F, you heard Moss both talking about what was incredibly important is affordable housing. That's one of the big questions we get all the time. But that's not just for the rank and file. We have physicians that we offer jobs to, and it's funny when they come back, they go, man, this is a great salary. However, I just saw a home down the block. My family would love to live there, but it's like 10 times more than where we came from. So affordability across the entire spectrum is something, and the workforce, we're heavily invested in. We have great partners in the community that help us do it, and we're really trying to build out all these talent pipelines.
Talk to us a little bit more about those relationships with the high school programs that you have. How are you working with the educators or the different schools to let them know about this future pipeline? I feel like for a lot of kiddos, that's like, I can't decide what I'm going to eat tomorrow. I can't think about my career.
They have a very hard time.
Yes.
They need more counselors to help them, right?
I mean, they can't even take care of their dogs.
No, right, exactly. So how are they going to figure out where their internship's going to be? What is well, that's why our thing really was, if there was a better way to educate high schoolers, and how can we do that? And the superintendent and his team have been trying to find better ways to do that. Still, there are a lot of really high schoolers that have no idea where they want to go, what they want to do. And for those that aren't going to go on to college, there are thousands of great jobs here. And you could career ladder in healthcare, in any of these fields that we're talking about. So the first big part and push is really going back to the high schools and trying to educate the student. But we found that the better person to educate is actually the parent. So we're quietly trying to work on some ideas of, can we do some mail or electronic emails, something like memos that would get out to the parents just saying, hey, does your son or daughter have any interest in the field of healthcare? If they do, look at these 50 different things that they can do, and here are all the healthcare systems that would like to share and talk to them about it.
And what about the university level? Are the partnerships within Broward County and possibly further afield?
Yes. Yeah. So we're partnered with every college and university here in Broward County and beyond, but we have great partners. Broward College, Nova Southeastern University. They're not only trailblazers, but they are built to help these folks in the workforce. So Broward College has had a strong nursing program for many years. They've got wonderful simulators. Nova Southeastern University, who we've partnered with and done a lot of clinicals. I don't know if anyone from NSU is here. Oh, great. So NSU is one of the larger producers in the healthcare professions. That they have over 400 physicians in their DO program. They have about 80 in their MD program. They have CRNAs. They have AAs, which are anesthesiologist assistants. There's a couple hundred. Those are critically important for our field. We just can't find enough clinicians and physicians. So we've started to work with the healthcare systems. We're not just doing the clinical rotations, but how do we think about better, stronger long-term relationships so where they almost feed, so when they do the training and they're learning at Nova or Broward College, come and do the clinical rotations with us, and then we want to offer them a job right away. And we do a lot of that. We're one of the larger graduate medical education programs in the state.
And what about the jobs of tomorrow? I know a lot of employers here are thinking about, we just saw a huge shift with AI over the past number of years, creating entirely new departments. And so we're trying to predict ahead what are the jobs of tomorrow. And certainly in healthcare, that's ever shifting. What does that look like when you're speaking to universities about potential degrees or potential certifications that you will need imminently or in the future?
So more specialists and subspecialists. People forget about that. So Broward Health and the Memorial Healthcare System have two children's hospital. If you're a fan of the Memorial Healthcare System, they have an amazing Joe DiMaggio Children's Hospital, and they're constantly trying to recruit and find more. But the specialists and subspecialists, things are really changing. And the other side of it that you didn't hear a lot of is more on the it's more the business side, right? So you're a physician, you come out with a skill set or a clinician, but what about the actual practice of operating your office? How do you understand the Epic implementations? How do you manage and work with your teams? It's not just the practice of medicine, but actually running a small business on their own. And then if I can brag for 2 seconds, so people used to have to leave the county for pediatrics. Joe DiMaggio was really the dominant player. Broward Health had a great children's hospital, but it really, Joe DiMaggio really spent time, money, and effort into building something world class. Broward Health had wanted to do the same, wants to partner with, so aspirationally, Nicholas Children's Hospital, Broward Health, and Joe DiMaggio are talking about creating for Florida its first children's hospital of Florida. 23 million residents, and we don't have something like that. But Atlanta has CHO, you have CHOPS in Philadelphia. These children's hospitals bring the best and the brightest, and the reason is there's a deficiency in finding these world-class physicians. For a pediatric neurosurgeon, that'll spend up until their mid-30s until they can actually come out and practice. There are only 3 of them that graduate a year that are board certified and fellows, and we're fighting for them at Nicholas, at Joe DiMaggio, at Broward Health. So the goal would be more of that collaboration, more of the better together. So I can share with you on March 1st of this year, the state of Florida at midnight allowed Nicholas Children's Hospital to now become Nicholas Children's Hospital at Broward Health. So it's really exciting for us. We were sending about 20% of our patients either to Jody or down to Miami. And the reason that's really tough and difficult is if you're a parent and you're working and you have a job, you love your kids, you'll do anything for them. But if they're in the hospital now and we're sending you to Miami or Tampa or another area that has that specialist, you have to take time off from work. You have to get in your car and drive there. You have to get a hotel while your child's there. We've really worked hard to make sure that every specialty and every service that a child would need will be done here and in Broward County. And I can tell you, since it's been a little over 90 days, we've already done pediatric heart procedures at Broward Health that we haven't done before because of Nicholas. So it's real exciting. So the next phase, thank you, will be, so the aspirational goal will be Joe DiMaggio, Nicholas, and Broward Health really creating this Children's Hospital of Florida here in Broward.
That's amazing. And to be ever more competitive, we need a community, right? It's about bringing community collaborators together. And and I would also like to mention that I will open up for questions from the audience. So I'll ask one last question. So if you want to think of yours while I'm asking one last question, go ahead. But what's the future of partnerships look for you? Not just with like other hospital systems, but when we're looking at the private sector and public sector, both more broadly speaking, how are you identifying gaps? How are you identifying partners from building new centers to anything in between?
No, so the partnership is the biggest thing. The biggest thing for me and what I always share with the team and with everybody else, I'm big on collaboration. I'm a big tent. I want everyone to have a seat at the table. I've been in Broward my entire life. I care about Broward County. I want us to have the best healthcare possible. But what that means is very different. Hospitals have been siloed forever. And the reason the hospitals kind of changed was because of COVID. Once COVID came, we started to partner more. are. We had weekly calls with CEOs across the states. What are you doing with the vaccinations? When are we getting the shots? What are we doing for the testing centers? And we really made it a community. We had walk-up clinics, drive-up clinics. We tried to do everything we could. And for the first time, instead of totally competing, we said, let's work together and get through COVID. And as a result, we've built better relationships. And we're doing that with the Jasons and the Nelsons and Lewis. When you think about it, we want to build and we want to do great stuff. You have partners out there that we don't know about it. So if someone owns land or wants to build or do something, how can we be a part of that? So take it one step further. The one thing we've been asked to take a look at is, what does housing look like? This is something that A&F and Moss and a lot of people are looking at, but we have the dirt, as you all call it. The hospital has been able to grow over the years, or contiguous property next to us we already own, have smaller facilities on it. The thought would be, after some of our expansion and a deeper dive into it, would it be possible to use some of that land where the first couple of floors could still be utilized for medical offices, but the top floors could be for workforce or affordable housing? And how would that P3 partnership look like? Because I've told these gentlemen before, I'm a healthcare guy. I'm not a builder, not a developer. I don't know how that works. I also don't want to be collecting rent or doing those things. So if somebody else can manage and run those operations, that's beneficial for everybody. I want to stay where we're good in the wheelhouse. So that's one of the things looking at. How do we do future development? Working more with our colleges and universities. There's a real overlap on trials, clinical trials and testing, things like that. How do we share this stuff? And then all of our partners, I wasn't kidding, but what's really nice is you talked about networking and getting people to be out here. You have all the folks in the audience here are all movers and shakers here in the community. They get stuff done. And I think as Broward folks, we really do work hard to try to get together and do fun things. But at the same time, we're trying to think about how do we continue to advance everything in Broward. So we're going to talk about the housing issue. We're going to talk about workforce. We're going to talk about economic. I'd like us people to think of us as an economic engine. The hospitals still are mostly forgotten, like I said earlier, until you need us. But we want to be a bigger player. We want to make sure that we have a seat and at the table. And if the community has ideas on where to go and what to do, we want them to think of Broward Health and Memorial as their partner.
And if anyone from the community has an idea, would you like to ask a question?
I see you got the Mayor's Sunrise here. There's another part. You know who I didn't mention? A freestanding ER is going to be opening soon with Mayor Ryan. Mayor, thank you. Look at that. I was just saying you got the mayor of Hollywood, freestanding ER there, the mayor of Sunrise. This is a great group.
So it's well, you touched on the breach that you had in the hospital. Um, I, I I love Memorial. I do. It's Johnson Street. I love it. I love it because the hospitality that's there, it does make you feel sometimes, even without your ability to pay, that you're welcome to come in and taken care of. So I did receive a notice that there was a breach when I visited the hospital. It was my medical and my financial. Um, so what the hospital did was to assure me that they would continue to follow um, the to investigate what happened. How did that happen? And it's been over a year, almost a year, and I haven't had anything to happen. So I'm assuming that that was taken care of.
Yeah, I can answer. Yeah, that happens all the time, unfortunately, not just with us, but
Okay.
with everybody. I mean, anyone that has a credit card, there's usually some type of breach or something that occurs. On those, what we do is we monitor them for you, and our chief information officer guy, Steve Travers, monitors every one of those. Those names go into a special bucket. If you're a patient, we want to make sure that none of the other information is divulged. We also then offer you two choices on who will do a credit monitoring service for 12 to 24. So we did that. I'm glad we did that for you. Most of it's okay. Some of them are reportable events. So in healthcare, if we accidentally have a fax with your name on it and I give it to the wrong patient as we're discharging him, that's a reportable event. We got to say something. We have to call you and say, we're really sorry. We gave your information to another patient, even if they saw it for 2 seconds. We were heavily regulated, but that is something that we definitely track and monitor. I'm glad you had a good experience with it, even though it was there, but we do monitor. And if you need anything, you could grab me after. I'll follow up
Yes.
for you.
And unfortunately, we are out of time. So please give another round of applause for Shane Strum, the CEO of Broward House. Shane,
Thank
thank
you,
you
Abby.
so
Thank you
much.
for having me.